and welcome. Thank you for choosing Cphk channel. This is where we help build sustainable One Health communities by having One Health clinics, produce and product value addition workshops, and a retail store, Soko Janja. I'm your host, Scholastica Mugi, and today we shift our focus on health issues, and particularly we focus on the Cphk journal, or if you like, the clinical proceedings from hospitals of Kenya. Now, today we are going to be continuing with our third episode of the Cphk journal. So if you missed on the first two episodes, please subscribe to our channel and you will see what exactly the Cphk journal is concerned with. So today with me, I have one of the researchers who is from the medical team. Her name is Miss Jane Jeremiah, or JJ. She's going to be telling us more about the progress and how far the Cphk journal has come in regards to the reports that the doctors are meant to submit. So, Miss JJ, how
Hello.
are you?
I'm fine, Scholar.
You're most welcome.
Thank you.
So nice to see you.
Oh, thank you so much for having me.
All right. So let's begin by giving just a recap on exactly what the Cphk journal deals with.
Okay, this is just simply a platform whereby doctors or anybody working in the medical field, we're talking about nurses, we're talking about medical students, they can submit their research work, they can submit their case reports, they can submit anything to do with ground rounds reports that they may be having. Yes, that's how simple it is. You submit whatever you have, case reports, ground rounds, yes, anything you want it to be out there for us to know, the Kenyan people to know, because this is mainly, we are focusing on the in our country. It is, we have a platform whereby we can include also other journals, from international people, but we are mainly focusing on Kenya right now. Yes.
I see. So now tell me, what progress have you made so far as now bringing these doctors and nurses on board to submit these reports?
Okay, what we have done so far, we have communicated with the people, the doctors and the nurses through telephone line. We have texted them. We also have a KMA Telegram group where we have listed doctors there, and we usually tell them, please submit your papers. Yes, so we've been doing that so far. And also for the past 1 week, last week and this week, we have been going out there to meet the people working in the hospital. We have met doctors, we have met nurses, and we are now on ground level. We are telling them now, meeting them physically, talking to them, taking this point home, because some of them are not on KMA Telegram group. Some of them probably are not reachable on phone. They could have changed numbers. So now we are physically meeting the doctors, physically meeting anybody working in the hospital department, and telling them and giving them our link where they can be able to submit the papers.
All right.
Yes.
And talking about meeting them, maybe you could tell us about what is the response so far from, as far as now you telling them about the reports and them submitting this report is concerned.
Thank you so much, Scholar. That's a very good question. The doctors are very happy. The nurses are very happy. And actually, the doctors are the ones who are telling us the nurses have a lot of report. They have a lot of research work they have done. So we are, they're very happy, and we are very happy that they are happy, because we want the health sector in our country to really improve. We want to educate. The main aim for us is to educate our community, our people. We want our people to know maybe there's a certain disease they faced and they were able to sort it or come to conclusion or be able to get answers. They don't just sit, our community should not just sit there and not know that there are answers to these diseases. And every day there are diseases that are coming up. So it's a very good platform, and they are saying it's a very good idea that Cphk is doing. Yes.
All right.
Yes.
So that means that probably it's actually the lack of this platform that is stopping the doctors from posting these things. So the moment I think you continue telling them more about the existence of this platform, they're so excited about it.
Yes, I'm sure there'll be very, very more people, more doctors will get to know, more nurses will get to know, more medical students will get to know, and they'll be able now to release whatever they have, the information, which is very helpful to our people. Yes.
Now, coming to now the reports, so far, how many reports are found in the journal, can be found in the Cphk journal?
Unfortunately, none, and that is why we are busy going now hospital.
Yes.
Like last week and this week we've started near Karen areas, because Cphk is found in Karen location in Nairobi, and we have started close by. We have started in Rongai. We have been to Aga Khan Hospital. We have been to Mariakani Hospital. We have been to Hope Care. We have been to Medical Center. All those situated in Rongai. The good thing with Rongai hospitals is the hospitals are very close by to each other, and you know, doctors move from hospital to hospital, which is an advantage. Yes, so we have started from home, and we have reached out to many doctors, and many are willing to do this, and many are willing to come to Obrika offices to meet the Ubrika president, that is Dr. Macharia Waruwingi, the KMA representative, chairman membership, Nairobi division. So we have invited them to come. They can speak to him. They can ask any kind of question they want. Yes, so they are very much welcome to our offices as well.
All right.
Yes.
And so maybe you could talk about maybe the charges, because maybe some of these doctors, the reason as to why they have not been able to submit these reports is because they think that maybe their charges. So to clarify on exactly what the doctors need to be able to publish these reports on the CPHK journal.
Doctors, nurses, medical students, anybody working in the health department, just know this is free. We are not charging anything. This is just for us. We want people in our communities to be educated.
Yes.
We also want to learn. So many people want to know what you're going through, all those case reports, and probably because they share it, other people might give them answers, because there are different problems in different health sectors in any hospital. This hospital faces this, and this doctor faced this problem, the challenges or the answers they come to. It could be that if somebody could read and understand this doctor is facing this, they could get answers. So far, just know it's free. So please share what you have. Yes.
So you have said that there's no limit to how much one can publish reports. Is there any limit?
No limit. No limit. You can give us. You can publish so much. You can submit your papers online every day if you want. There's no limit to any person.
All right.
Yes.
So maybe you could give some of these doctors your contact. You could say the contact where they can find the medical team, and probably if, maybe some of these doctors want to visit you, or want them rather for you guys to go visit them, and maybe they submit their reports. Maybe you can give us the contact, and as you tell us the parting shot, and encourage more doctors and nurses to publish their reports.
We are going to leave all that information below this link. We're going to leave all that information before this the YouTube channel. We are going to have all that, the contact, the email, that where you can reach us, or how to submit the papers. It's going to just be below. Yes.
All right. Thank you very much, Jane.
Thank you so much.
We wish you all the best as a medical team, as you encourage more doctors to submit these very critical reports that the public needs to know, so that at least we're able to curb all these cases of death which should not have actually taken place in the first place. All right. Thank you so much.
Thank you so much for having me.
All right.
Yes.
Have a nice day.
You too.
All right.
Thank you. Bye.
So there you have it, dear viewer. The CPHK journal is all about understanding the critical events that take place in the hospital. And so we urge doctors, nurses to please come on board, publish your reports. As you have heard from Jane, you absolutely pay nothing to publish your reports. And so we need to educate the public. So please come on board, publish your reports, and you will help a great deal. Thank you very much for watching this video. Please subscribe and click like, and we'll see you on our next video.